Now to talk health, and the Kenya National Union of Nurses and the government struck a deal that ended a 5-month-long strike that has paralyzed operations in public hospitals across the country. Nurses at different facilities in the country began to troop back ready for a role that they had been forced to put aside and focus on other activities, at least to earn a living. Cecilia Kesho now tells the story of several hospitals that now have a breath of life.
Nurses at different hospitals in the country began to resume work, with a majority of them enthusiastic. They are going back to work after being on strike for 151 days before yesterday's announcement that ended the strike.
Ukiniangalia hivi kulingana na ile kazi nimesomea bado naweza fanya kazi ya kinyozi, so ilifika wakati mmoja katika my savings nikafungua kinyozi angalau iendelee kunipatia pato la kila siku.
Mgomo ulikuwa gumu, hatungeweza kuikimu mahitaji yetu si wenyewe, so ilibidi wengine wetu kuangalia namna tu venye utasurvive.
A majority of the nurses seemingly eager to play their role, although the better part of today was spent in consultative meetings, cleaning of wards as well as counter-checking their tools of trade. The nurses, whose demands included a 7.6 billion shillings annual collective bargaining agreement, have had to cede some of their demands to almost half.
I know that the agreement may not be sometimes happy with some of our members, but I can tell them this is what we have been able to get from the government.
We are very grateful as the nurses of Nyeri County that finally, whatever we've been out for, we've come to an agreement, and we hope the government will they'll actually bring to implement whatever they've promised us.
In Trans Nzoia County, nurses were reluctant to go back to work, with one message to the county government that has withheld their salaries since the onset of the strike on 5th June.
We have to be paid by the end of November. We are expecting 5 months' salary, and we don't want to be given in installment. Because by being paid in installment, it means that nurses will continue suffering as they continue paying bills when they don't have anything to take at home.
Apart from the collective bargaining agreement of 2017-2022, the nurses will receive an additional 5,000 shillings annual uniform allowance to the current 10,000 shillings. It is an amount they will receive from 2018-2019 financial year. 3,500 shillings nurses service allowance will also be increased each year to the current 20,000 shillings annual allowance. The current risk allowance of 3,850 per month is, however, yet to be negotiated.
We say pole for our patients, and we really miss them so much.
Cecilia Kesho, KTN News.
Well, as politicians and technocrats across the country have been haggling over budgets, salaries, promotions, and their impact on the government's current expenditure, very few rather, have paused to think about the impact of this nurses' strike that has just concluded. Nurses were on strike for 5 months, which has had adverse effects, meaning hundreds of thousands of children across the country did not get the needed vaccinations, as well as expectant mothers who could not visit their usual clinic checkups. So in studio for this discussion of a possible medical crisis facing this country is Boaz Onchari, who is the chairperson of the Kenya National Union of Nurses Nairobi branch. Many thanks for joining us in studio, Boaz.
Thank you.
We also have Winnie Kubai, who is a pediatric nurse at the Kenyatta National Hospital. Winnie, many thanks for being with us today. And last but not least, we have Jones Osore, who is a student nurse at the Kenyatta University. Many thanks for being with us this morning, Jones. So, of course, it is a sigh of relief for the country with nurses having gone back to work. But let's go back and take a look at the impact of these 5 months that nurses have been out of work. I'd like to begin with you, Winnie, especially being a pediatric nurse at the Kenyatta National Hospital. Many mothers, expectant mothers, have been unable to visit their usual clinics. Many children have been unable to get their usual vaccinations. What is the gravity of this situation for the country's children?
To be honest, I would say that the gravity or the magnitude is huge. For the few months that, or for the many months that the nurses in the counties have been on strike, we in the Kenyatta National Hospital have been functional. And there has been a surge or an increase in the number of, especially the neonates that have been admitted. One thing I can pinpoint for sure is that those mothers that missed their antenatal clinics missed a lot of education that is usually or precisely given by the nurses.
Right.
And missing on this antenatal education means that they missed a lot of things that they would have done before or after the delivery of their children, especially considering that they are usually trained on how to have a birth companion, how to have a skilled delivery, how to, there is a booklet that is usually provided that was launched by the Ministry of Health in 2013. And this book contains a lot of information, and many mothers didn't have it, so they could not tell about the danger signs that come in after a child is born. Right. So the many that we received actually came with those complications that arise in the very first few hours and up to a few days of birth. There were very many, and the other sad bit is that most of these mothers had delivered in different places. We had mothers who were delivered at home. We had those that delivered in a chemist, because that was the only near medical facility that is open for them. So they came with complications of cord infection. It is a very serious issue. Some came with even complications of having not been wrapped up well, so that they come with cold stresses, or we call it hypothermia. A hypothermia to children causes a complex of 3 issues that actually cause death. Others came with complications of yellow in the eyes, we call it jaundice. Actually, this will come about trauma at birth. Others came with what we call severe birth asphyxia, and this severe birth asphyxia actually results to some major disabilities later in life. So we may say that the magnitude is huge. It may not be felt in the country right now because they will not be out somewhere like, these are the people who were born during the strike and this is what happened to them. But those different or many families that underwent them, they may later become economically unproductive because they may be forced to spend time with their disabled children in the home. We may have a lot of actually deaths. Yeah. So the magnitude was huge. Right. It may not be actually like pop, you see it, but it will be felt.
Of course, it is something that is not being discussed. Well, perhaps you could expand a little more then on the impact of many of these mothers coming with such complications. Some of them survived, of course, but many medical experts say then they face lifelong complications going forward in life. What complications specifically, what impact is that likely to have on the health in society?
Okay. First, I want to say thank you for inviting us so that we can tackle the issue that has been in the past actually 6 months. But then because of the political let me call it instability that has been in the country, then it's like the government ignored the core sector in its mandate. I could want first to apologize to all Kenyans for the suffering that they have undergone during the time that we nurses have been on strike, and also mourn with the families who lost their loved ones during the time that we've been away. It is true that the impact may not be immediate as many could see, but then in the next 3 to 5 years to come, then Kenya is going back to some of the conditions that we had dealt with coming back. You saw the cases of polio that we've been fighting coming back. You saw the issues some of the conditions that actually we had kicked out of Kenya. Now they're coming back because the hospitals have been closed. And immunization is given to prevent, not to treat or rather to cure. It is given to prevent. So if these immunizations were not given, then that means that the children missed an opportunity, which is their right, and it may not be meted, but then it may affect them in the near future. Yeah.
And we'll be discussing some of those diseases, especially the ones that have been singled out as health threats to the region. But let me hear from you, Jones. As a student nurse at the Kenyatta University, you of course depend a lot on nurses, in many of what you are learning. How have you as a student felt the impact of the strike?
First of all, I'd like to say that students across the country, close to around 140 institutions in the country, have been also on the receiving end of this strike. We must agree that these nurses in the hospitals, they serve as clinical instructors. and they are our mentors when they go to undertake such clinical experience. And when they are not in hospitals, that means that we cannot go to undertake that important part of our training. So one of the effects that we faced is that we missed that part. And many of the students in the country were forced to stay at home because the hospitals were closed. And this will impact in the long duration training, because it will result in having half-baked individuals coming out, you see. Yeah, we noticed also some of the interns across the country, close to around 750 interns, they are not able to undertake their training, which is part of the curricula stipulated by the Nursing Council of Kenya. So when they miss this critical, important part of their training, it means that they won't be competent enough when they come out of in the market to take care of the patient. So that is one of the things that we have suffered as students.
Right, and of course, that is a big gap in the health sector, because nurses, again, play a very instrumental role. So we'll be discussing that in a bit more detail. But let's focus a little more on the impact then in terms of the disease crisis that we're likely to face in about 5 years from now. And there's major vaccinations, like the polio vaccine, the measles vaccine, the meningitis vaccine. These have been singled out as some of the biggest health threats in the region. And so, for a child who has missed a polio vaccine, for instance, let's hear from you, boys. What is the likelihood, what is the likely quality of life that this child would have?
Thank you for the question. As I mentioned earlier, that we immunize to prevent. Now, take an example that this kid has missed that opportunity to be immunized against polio. What impact will it build in this kid in the next 2 to 3 years? First, you limit this kid to so many issues that each and every human being should undergo. Polio, as it is, we've known it comes with paralysis. So you've subjected this kid to something that he or never wished to have, and since kids don't know, we call them angels. And because of they missed this opportunity, then we subjected them to so many conditions that we could have avoided had they been immunized. So when you see somebody being paralyzed and on a wheelchair from the word go, then you've restricted this person to even attain his ambitions in life, just because of the paralysis. Yeah.
All right. Let's hear from you, Widi. Is it too late now for expectant mothers who found out they're expectant just at the beginning of the nurses' strike to reverse some of the adverse effects that may have already happened without the usual clinic visits?
I would say it's a bit too late for those that missed out on the events.
Because they're done at specified times.
Yes, pregnancy is a journey. It has specified events that happen at each stage of pregnancy. So if they missed out on some things, then they cannot go back to them. I want to give a very particular example of the IFAS, or the iron tablets that the mothers receive. Iron is supposed to be taken immediately someone discovers they're pregnant, or at least when they go for their first visit. Because what iron does, one, it prevents the development of the neurotube defects. And the neurotube actually closes very early in pregnancy. So if this mother didn't get them in early pregnancy and the neurotube closed, then we cannot reverse that. Right. If the neurotube developed with abnormalities, we cannot reverse that. So they definitely give birth to a child with neurotube malformations or deformities. Another thing is that the iron tablets usually give iron that is required by the child. So if they didn't get such, then they miss. We have the anti-tetanus vaccines that are usually given to the mothers. These anti-tetanus vaccines prevent both the mother and the child from tetanus. And one thing I want the world to know, or the people to know, is that most of these preventable diseases that we vaccinate upon are not somewhere very far. They're usually from within our bodies. Right. Yes. They are found either in one particular part of the body, so that if they migrate to another particular part of the body, they cause an infection. So when we say we are vaccinating against these infections, we don't say they are very far. They are usually within us. So something like tetanus, it is a germ that is usually found even in our own gastrointestinal tract. So when these mothers give birth, what we have is the risk of having infection through the placenta site and through the cord stump of the baby. So if actually the schedule of giving the antitetanus vaccine comes early in pregnancy and during at least during the first or the 16th week and another week for the first-time mothers. So if someone missed them during that time, then they may not get them later. Talk about something like a disease we call preeclampsia. It is, you have to have a baseline of the blood pressures before the 20th week so that you can compare with the blood pressures after the 20th week. Some people usually have a normal low blood pressure, so that if it has risen by 15 or 20 millimeters of mercury, which are the measures that we use, they may not realize later because theirs were low. So if we come with a normal BP, we may think it is normal because we don't have a baseline that was done early in pregnancy. And what may happen is, actually these children suffer, they suffer malnutrition in the uterus. And then the worst thing that can happen is that this mother can go into something very bad we call eclampsia, which involves convulsions, and it affects both the mother and the child. It can even lead to things like the kidney failure. So the mothers are supposed to know their baseline observations, and then the continuous or the follow-up. So all these have been missing. So it may not be really possible to reverse some of the major ones.
All right, so the gravity of the situation, you know, is clearly a serious situation. But Boaz, look, diseases like measles, for example, I mean, these are things we've made serious strides from as a country. I mean, by 2015, the number of children killed by measles every hour was about 15, and that's a high number. You know, 15 children an hour because of measles. And these are other diseases like meningitis. We have pneumonia. We have influenza. What then do we need to start doing as a country to prepare for the coming health crisis?
First is I could want the government, and this is a very genuine concern and an advice to the government. You see, the people who are involved in giving immunizations to children are the nurses. When the nurses are out of those institutions, then there is total breakdown of services in those institutions. So if they can look into the issues that nurses raise, they are taken into considerations and worked upon, and solutions are get, then I believe that some of the challenges that we are facing as a nation can be tackled with a lot of ease. Now we are here. Yes, nurses, we are back to our institutions. We are back as wounded lions. And when a wounded lion is back to its den, it may not come back as it has anticipated. We went out because of a CBA. We haven't gotten a CBA. Out of that return to work formula, yes, we have gotten what was offered, but that was not what we expected. So even as we are back to the institutions, there is still that element of motivation. And motivation generally comes with even attitude. If the government creates that attitude that we don't value nurses, then the same way these nurses are going back to their workplace with that attitude that we work in public hospitals whereby the government is not concerned about our issues. So to some extent, those services may not be given adequately. So the government should fasten and come up with a solution to this stalemate, because I believe we're counting down today is 26 days to go before our CBA is concluded, so that nurses countrywide are motivated, even when they come up with programs that they have been trying to link with the NGOs. Even the NGOs are just using the government nurses, because when they organize campaigns for like polio campaigns, it is we nurses in the government institutions that do give those vaccinations. So it is good that they solve issues that are related to the nurses, so that when as we are back into our institutions, then they can now mobilize. We do campaigns because we believe during these 5 months that we've been out, so many kids have missed those immunizations. And we always target the under 5s, so they can still come up with measures, organize campaigns. We go to the field and get these under 5s. We try to curb what is ahead of us.
All right. And let's just discuss what Jones brought in, being a student nurse, the issue of training and the fact that a lot of training has been missed in the past 5 months. Yes. What kind of training specifically during the 5-month nurses strike were you to undergo as a student nurse that you couldn't do because nurses were on strike?
As I said earlier, these nurses in the hospitals, they serve as they are the mentors. When you go to the hospitals, they are the ones who are supposed to show us that this is what's supposed to be done. When patients come with this type of condition, you're supposed to handle them in this way. So you find that when you miss that critical information, we may not be able to handle a patient in future. You see, when a patient comes with a certain condition that you are supposed to undertake at a certain time, because you find that the way the clinical experience is supposed to be structured is that during every year, you're supposed to undertake a certain kind of experience. For example, maybe in first year, you're supposed to know how to handle a mother and child. In second year, you're supposed to handle a medical or a surgical patient. In third year, you're supposed to know how to handle a psychiatric patient or a mother in labor. You see, so when you miss that particular time, let me give for an example. I'm in 4th year right now, and I missed those 5 months clinical experience. And you find that maybe in that 5 months, I was supposed to be in the eye clinic, in the ear and nose clinic, in the surgical theaters. When I miss that kind of experience, that means that when I graduate and when I come out to the workforce, I won't be able to effectively manage a surgical patient when I come up in such a situation. So those are some of the long effects that you are going to experience. You see, you're going to have half-baked individuals in the market, and the employers are going to complain, you see.
You're right, and of course, not just the employers, but also the patients. Really, what would be your experience with this, especially with student nurses and the impact of what Jones is talking about? Because this nurses strike came just a few months after the doctors' strike were also very instrumental for the student nurses and the nursing, the student medical practitioners as well.
Okay, what I would want to say is from our institution, it was difficult. We had students from few KMTCs that are around, but it was difficult to mentor them. Why? Because of the increased workload. And I want to say one thing, that nursing is made of compassion. Right. The workload affects our delivery of that compassion. So it makes us go home dissatisfied. And there's nothing as bad in this world as having lack of job satisfaction. We want to teach the students, and we actually mentor them a lot. They learn through our giving reports. They learn through us performing procedures. They learn through us holding discussions with them. This has not been possible during the whole period because of the workload. So we actually counted the few students that we had as part of the workforce. So actually, I would say the ones that we had during this time may not have had it very smooth. They learned the hard way. Because we used to allocate them like you are allocated to work. And if you kept listening around, you could hear of counties that were actually using the nursing students to work, which is also not very good, because they're supposed to work under supervision. Remember, we handle human life. And a student nurse is not supposed to work under no supervision. It was actually very wrong to have students working without the nurses. But then, I think humanly speaking, they had to go and give the little that they had in
helping the situation, as was.
But it was not easy.
I'll just take a short break, but Boaz, perhaps you can address some of the important government projects or health projects that have received setbacks in the wake of the strike, and one of them is HIV programs. Mother-to-child transmission, for example, the prevention of it has been something that has suffered a huge setback in this 5 months nurses strike. What is the impact of that particular project?
That is very true, and that is where I've said in a number of issues during this time that the nurses have been out, as we've mentioned, like mother-to-child transmission, that is purely an area that is related to maternity. So while during this time that we've been out, so many mothers have missed that opportunity. Even as we speak, some of them don't know if they're HIV positive, and having delivered at home, they continue breastfeeding. You see, now there's that transmission from mother to child. And then now the impact we're going to see, instead of we decreasing the numbers, then we're increasing the numbers. So by the time that we'll be realizing this, and then where will be our GDP as when we speak of the Vision 2030? Yes. So instead of decreasing the issues that we should be at the front line, then the government actually has made it impossible for us to attain that goal. So as I've always said, that our position as nurses is if our issues are articulated, because in many cases they call it a calling. Yes, it is a calling when you're motivated and when you have that attitude towards what you're entitled to do. So if we really need to overcome this challenge that it has happened, but then now we need to look at how we're going to curb this. It is now the government to come up with measures. How are you going to get these mothers who missed this? It is just through, we let them organize so that we go into the field. We go into the villages and get these mothers out. We know they are there. We can even identify those mothers who haven't been, maybe their kids haven't got immunization. And through the records, through the social mobilizers, then we get these records and we give the necessary to these mothers so that we can try curb this mess that has occurred within the 5 months.
All right.
Yeah.
Let's take a short break right now on Weekend Express. We're discussing the toll that the just concluded 5 months nurses strike has taken on the country's healthcare system. Medical experts say a looming disease crisis awaits the country in the aftermath of the 5 months nurses strike. I want to take a short commercial break, but remember, our numbers are on the screen. You can also call